Welcome to The Explainer. Today, we're tackling something that impacts literally millions of us, understanding knee pain. Now, if you, or maybe someone you love, is over 60, you already know knee pain isn't just some minor passing ache. It's an incredibly common, super frustrating roadblock that can seriously tank your overall quality of life. It can literally stop you in your tracks.
Which brings us right to the big question, why do our knees hurt so much as we get older? It's a question with a massive physical and emotional toll. The loss of mobility, that constant nagging discomfort, honestly, it's exhausting to deal with day after day. But they're very real, highly specific biological and mechanical things happening right beneath the surface. So let's dive into this.
Okay, here's our quick roadmap for today's explainer. First up, the reality of knee pain. Second, 4 common knee pain causes. Third, diagnosing your knee pain. And finally, managing pain through weight loss. We're going to follow the whole journey, right from those very first symptoms all the way to a proven, evidence-based solution.
All right, part 1, the reality of knee pain. Look, we have to acknowledge right out of the gate that knee pain is a major roadblock. The causes of knee pain in seniors are definitely multifaceted, ranging anywhere from degenerative conditions to really specific injuries. Think of the human knee as this incredibly complex machine. It's got hinges, shock absorbers, stabilizers, the whole shebang. And just like any complex machine you use every single day, the pain you're feeling often stems from mechanical breakdowns over time, or even biological breakdowns within the system itself.
Moving on to part 2, 4 common knee pain causes.
So, culprit number 1 is osteoarthritis. This is the gradual breakdown of your protective cartilage, which inevitably leads to bone-on-bone friction, stiffness, and severely reduced mobility. And actually, this is the most prevalent form of knee pain out there. Going back to our machine analogy for a second, imagine the protective cushioning in your car suspension completely wearing away over time. Without that vital cartilage there to cushion the ends of the bones, you're left with this very real, very visceral bone-on-bone friction. Ouch, right?
And this brings us to a really crucial contrast. While osteoarthritis is the mechanical breakdown of cartilage, the classic wear and tear, rheumatoid arthritis is completely different. It's a biological issue where the body's own immune system mistakenly attacks the joints. So, instead of a mechanical wearing away, you're dealing with a biological attack that triggers severe inflammation, intense pain, and eventual joint damage.
Moving right down our list of usual suspects, we've got bursitis. This is the inflammation of the bursae. What are those? They're basically these tiny fluid-filled sacs that cushion your joints, and they often flare up just from repetitive motions or prolonged pressure on the knee. Plus, we also have to recognize that your acute or chronic pain could just be the result of a direct physical injury. We're talking things like ligament sprains, meniscus tears, or fractures.
Okay, part 3, diagnosing your knee pain.
Getting a precise diagnosis is absolutely 100% essential before you even think about starting treatment. You just can't develop a game plan without knowing exactly what's broken. So, we're moving our patient journey right into the doctor's office. The diagnostic toolkit follows a really clear step-by-step process. Step 1 is a thorough medical history review. Step 2 is a hands-on physical examination of the joint. And Step 3, targeted imaging and blood tests. Doctors basically piece together the clues from these 3 steps, almost like a puzzle, to hunt down the exact root cause of your discomfort.
Now, what's genuinely fascinating here is why doctors use specific tools for specific tissues. It makes the whole medical investigation totally logical. For example, X-rays are perfectly suited for spotting hard tissue issues, like bone spurs, joint space narrowing, and classic signs of osteoarthritis. But if the doctor suspects soft tissue damage, say a ligament or cartilage tear, they need an MRI scan. Then you have ultrasound, which is the absolute go-to tool for spotting inflammation in the bursae or tendons. And finally, a simple blood test can easily confirm or completely rule out that overactive immune response we talked about with rheumatoid arthritis.
And that brings us to part 4, managing pain through weight loss.
Once your doctor zeroes in on the root cause, they can tailor a specific intervention just for you. Now, sure, this might involve medication, physical therapy, or sometimes even surgery. But honestly, the most empowering solution is often the one you have total control over, maintaining a healthy weight. And it's paramount. Every single pound of excess weight translates to several pounds of additional pressure on your knees. Let's think about the actual physics of the knee for a second. Excess weight places a massive, constant mechanical burden on those joints. It actively accelerates the degeneration of that precious cartilage, and it seriously exacerbates your pain during everyday stuff, walking, standing, just climbing a flight of stairs. This extra pressure doesn't just make existing pain worse, it actually drives the progression of conditions like osteoarthritis.
So, the magic number here, the absolute crucial point, is 5%. Studies have consistently shown an incredibly strong correlation between weight loss and massive improvements in pain, stiffness, and overall physical function if you have knee osteoarthritis. Listen to this. A reduction of just 5% of your body weight can lead to highly noticeable improvements. 5%. That is an incredibly empowering number. It means you absolutely do not need some extreme overnight transformation to start taking the pressure off your joints and actually feeling some real relief.
Of course, actually achieving that reduction requires a comprehensive approach. You're looking at dietary modifications, getting some regular exercise, and making sustainable behavioral changes. It's about adjusting the whole lifestyle. And while hitting that 5% mark is a fantastic, life-changing milestone for noticeable relief, it's worth reminding ourselves that even more substantial weight loss is going to offer even greater benefits to those knee joints.
And the best part, you really don't have to navigate this whole thing alone. As our source material points out, consulting with a registered dietitian like Dr. Sumaya can provide personalized guidance on creating a sustainable and healthy eating plan. Relying on professional guidance is basically the smartest way to build a personalized lifestyle intervention that you can actually stick to, ensuring you're losing weight in a way that truly, deeply supports your joint health.
So, we've explored the harsh reality of knee pain, we've uncovered the mechanical and biological culprits, looked at the logic behind the diagnostic tools, and broken down the undeniable physics of weight management. As we wrap up this explainer, I want to leave you with one final, provocative thought. If losing just 5% of your body weight could completely transform your mobility and get you back to the life you love, what small step are you going to take today? Thank you so much for exploring this with me. Keep learning, stay curious, and take charge of your health.